Hi, everybody. Welcome to Partners in Conversation. Today, we're focusing on the role of trauma in equity and social justice. My name is Monica Solina Saunders. I'm an associate professor in the School of Public and Environmental Affairs at Indiana University Northwest. And my guest today is Elaine Spicer. She's the director of the Institute for Community and Family Resilience. Welcome, Elaine.
Thank you. I'm happy to be here.
So how are you?
I'm okay on this almost sunny day or periodically sunny day.
We are hoping for spring.
Yes, we are.
We're very happy to have you at the show. And I would like to invite you to share with us something about yourself, your experience, and what brought you here.
Okay. Well, I'm a licensed clinical social worker and have had almost 40 years plus experience working with children and families, mostly in the area of child welfare and some juvenile justice, as well as working with families in a domestic relations bureau in Tippecanoe County when I was there. Also did child protective services for a number of years. My specialty is definitely trauma-informed care and building resilience. So not only understanding trauma-informed care, but what you do about it. And currently, I am the director of a not-for-profit called the Institute for Community and Family Resilience, which I founded in 2019. It seems like that should just be last year because we sort of lost a whole year, but with a mission to promote the understanding of adverse childhood experiences, or ACEs, and trauma through education, consultation, and support. And so that education, consultation, and support goes to several systems.
Thank you, Elaine. Obviously, whoever is listening to us today knows why we have chosen Elaine for this interview. It seems to me that more and more in the media, we hear about individuals who suffer in many different ways within the criminal justice system because they are maybe apprehended by the police who didn't understand exposure to trauma and the effect of the exposure to trauma, their mental health problems. And so it seems that this conversation is pertinent to all these issues that we're seeing in the community these days. So I would like to ask you a few questions that maybe are a little more specific. Sure. The first question perhaps is, we often hear experts who focus on trauma and trauma-informed intervention discuss ACE, adverse childhood experiences, but we don't really know exactly what ACE is. So can you explain to us what ACE stands for and why it is important to focus on ACE?
Well, I'm always trying to come up with an elevator speech to describe ACEs and what it's all about. And here is my said speech, which I have to almost write on my hand or on my arm because I can't remember all the pieces of it. The Center for Disease Control and Kaiser Permanente did a study, actually in 1998, which seems like a very long time ago. And it probably took another 10, 12 years for it to catch on as far as throughout the country, people understanding. It revealed in different ways the effects of childhood neglect, abuse, and family dysfunction and how it can affect people beyond childhood. Their study involved 17,000 people who were primarily middle class, actually middle class white people primarily. And they asked people questions that related to emotional abuse, physical abuse, sexual abuse, family dysfunctions, and such as incarceration of someone in the family, domestic violence, and mental health issues, as well as questions regarding their own current health status and behaviors. And I should point out that there were only 10 questions in the initial ACEs survey. And the results found that people who had a higher number of ACEs, or adverse childhood experiences, were more likely to have negative outcomes later in their lives, and had high-risk behaviors, social issues, disease, disability, and oftentimes early death. The study brought to light not only the prevalence of ACEs, because we're talking about 17,000 people, but also the fact that the effects of ACEs cut across class lines, gender lines, socioeconomic lines, and that ACEs disrupts brain development. And so all of these issues, they're cognitive issues, social issues, emotional issues. So it's behavior and learning as well as physical health. That's my elevator speech.
It's impressive. I'm really impressed with how much information you are able to fit in this definition. And I think it is very important for anyone interested in trauma and trauma-informed care to understand these new innovative approaches. So let me ask you another question. There is a follow-up. So we hear about these studies that are done to validate these measures, but is ACE only used with kids?
No. As a matter of fact, it's important to understand what's happening to children, but it's also important when we view the behaviors of adults. And I guess it's always in my mind when I pick up the newspaper and I read about a crime that's been committed, and a crime that's been committed by, a 24-year-old. Okay, and you're wondering why a 24-year-old would, do a house break-in and confront the people who are living in the house and that sort of thing. And I'm always wondering what happened to that child, what happened to that adult, that this is what he or she does. And we know that all of the effects from childhood do play out in the behaviors of adults. And so it's an understanding of trauma. And I used to, up until very recently, think that trauma-informed care, that it should be trauma-informed response. But I've realized very recently that care literally means care. You understand trauma, and then you care for the people who have experienced trauma. And the thing is we don't wear signs on our backs that say, I have an ACEs score of 4 out of 10. But we have some behaviors, especially if we're triggered. So it's important to understand trauma and its effects on the brain and on the body. So it's important for physicians to know what somebody has been through. It's important for teachers to know, vital for teachers to know. I happen to think that it's important for law enforcement to know, emergency responders to know, juvenile court judges to know, and family court judges to know, and criminal court judges to know, and all of the people in the court systems. I think it's important for our city government to know who the people are in the city, what they've come from, and what may be driving their behaviors.
It seems to me, Elaine, that understanding trauma is important for everybody in society, but especially, as you said, in the field of social justice, it is important that we understand where behaviors are coming from, what triggered those behaviors. And perhaps a little empathy would take us far in terms of understanding each other. So my next question for you is, what settings are most appropriate for ACE-based intervention, and which agencies could benefit from such an approach in our region? I know that you mentioned already different areas of the criminal justice system and different areas of social justice, but would you help us be a little more specific for people who watch this program and they want to know better maybe how to help out and whether the agency is qualified for using this approach?
I guess my answer to this question is that every setting needs to understand ACEs and trauma, and all settings could benefit. And I'm including churches. I'm including food pantries. I mean, we're assuming that social service agencies know this, okay? But I'm not quite sure there's an extension into all of the programs that social service agencies run, all of the programs that churches run, whether people who are manning those programs understand why the person who comes in and pounds his fist on the table and says, this is what I have to have, and this is what you have to give me. And so instead of picking up the phone or you slamming your finger on the alert button, you just try to bring it down. And the other piece of that is that we have to know our own triggers. Okay, we have to understand ourselves and our own behaviors to be able to deal with the public.
Very important. I think that this is very helpful for everybody. I have just one more question for Elaine. What are your recommendations for practitioners who work with individuals who might have experienced trauma? In other words, counselors, social workers, criminal justice practitioners, and teachers. We hear that you have mentioned already these groups of professionals, but what are your recommendations for them?
My recommendations have to do with, first of all, what we've learned, that what's predictable is preventable. So if you can predict that a certain part of the population, and I don't mean racial parts, I don't mean religious parts, I don't mean gender preference parts, but people in the population, you can assume that people have experienced some kind of trauma. And we tend to want to know what's the matter with you, instead of, wow, I wonder what happened to you. And not that we have to be a therapist or a priest or whatever to each person we meet, but this understanding, this lens that we see people through is, okay, we're not all alike, nor have we all had the same experiences. And so being aware of trauma and its effects can help people respond rather than react to people. And you can say, so, and then what? Okay, well, and then what? Believe it or not, just being there for someone, just being present makes all the difference. And so that person who comes in and pounds their fist and says, why can't I get food? Because I don't have a driver's license to show you, or any kind of registration to show you. I need food. My family needs food. What do you mean I can't have food? And so if you just understand that this person just needs you to hear this, and maybe she needs you to explain why you have to have some kind of proof. I don't know, you've got a person there who needs food, but that's another time to talk about that. But it truly is, you can truly be the one for that person on that given day. and teachers and school people understanding, you know, what kids might have left at home that morning when they come to school. What may be going on now that everybody's on Zoom, in the background. Why is that mother sitting there for 4 hours with her child when she doesn't have to be there? What is she afraid her child's going to say? Okay, that kind of thing, just an awareness and then a presence, a responsive presence instead of a reactive presence can go a long way.
Thank you so much, Elaine. I think this is a great clarification on what ACE means, because we hear, we see actually this acronym everywhere. Oftentimes it's not even spelled out. And I know that many people who listen to this program would benefit from this explanation. Thank you so much, Elaine, for joining us today. And I wish you luck with all the work in the community. And I hope that you'll be willing to come to the program again.
Absolutely. And thank you so much for having me. It's something I'm passionate about, and I really want people to understand it. And in order to understand one another, I think it's important. So thank you for having me.
Thank you.